the process of getting the diagnosis, and then, based on prevention and management. So hopefully we can cover all of this. So I was talking to Sister Fariza this morning, and there are two big aspects of this discussion. One is that we are concerned about ourselves. So what to do to prevent it? So today I'm going to focus more on that piece. But I still understand that a lot of us have family members, or we are the caregivers for people who have dementia or who have chronic illness. So that talk can be, it's a whole talk by itself. So I don't think we can cover everything. Maybe we can do a part B for caregiver burnout, caregiver responsibilities, what resources to use, how to navigate through different challenges of different stages of dementia. So I don't want you to think that I did not, I'll try to cover what we talked about, and then we can have another talk about from the caregiver perspective, which is a whole big topic and very important one also. So let's start. Anything that I say which is correct is from Allah subhanahu wa ta'ala. Anything that I say incorrect is from shaitan and from my nafs, and may Allah forgive me. And may Allah reward you all for being here. Jazakallahu khairan. So as the brother was saying, first thing is niyyah, why we are here. So if we did not renew our niyyah, let's do that. Like the brother was saying that, two people do same things, and one gets the ajr, the other does not, based on the niyyah. So our niyyah is here, that we came here for the sake of Allah, to be aware of, get more ilm, to get some awareness, to take care of our body, our mind, for the sake of Allah subhanahu wa ta'ala. Illness, any illness, prevention is better than cure. Duas, askar, we want to make sure that we are consistent with it. And we don't know the dua that we do today, how is it going to help us 10, 15 years from now? Sadaqah is always, a great weapon to nullify the effects of something that is yet to happen, that is negative. And obviously to learn and to apply as much as we can. So even if we take few points from this talk, walk out with few points that we can apply, that's, then the purpose is served. So let's talk about next, what's the difference, when do we use dementia versus Alzheimer's? Very simple. Dementia is a bigger umbrella term, and dementia has multiple kinds, Alzheimer's being the topmost, most common kind of dementia. 80%, 75 to 80% of people have Alzheimer's dementia. However, that, under the umbrella of dementia, there can be dementia from stroke, dementia from Parkinson's, dementia from Lewy body, dementia, mixed kind of dementia. But when we say dementia, Alzheimer's is covered in it. And it is a subtype, the most common cause. That's why these terms are usually overlapped, because the presentations are same. However, in other kinds, there are certain signs and symptoms that the physician looks at to make sure that we are not dealing with something else, Parkinson's, and we are treating them as Alzheimer's. So that's why we have to, but the terms can be easily overlapped. And it is totally fine to say Alzheimer's as dementia. However, to be specific, we know that it is the most common kind of dementia. Okay, now we can talk about normal aging versus Alzheimer's. So somebody who forgets once in a year appointment to the doctor, or forgets to keep the keys, lost phone one time, so these sporadic things happen. It's normal. We are insan, and insan means that we forget, So we have to see where are the red flags. Where does it become abnormal that, I forgot my phone again. I have to go back and, in the car and get back my phone. Or, I forgot to take this exit. Not because, I have dementia, but I was thinking of something else, what I have to cook tonight or something, So all that is within the norm. We have to look at certain red flags when things are more consistent, they have a trend, and it's affecting the activity of daily living. somebody is not able to complete a task because they forgot a big fact that was very obvious, but they cannot recall it. So I will go in more detail about that. Um, Trouble having a conversation. You start a conversation. A lot of times, we see somebody, we don't remember the names, that's fine. But when you pause and then you are not able to retrieve what you were talking about and how to continue a conversation, and it's consistent, and you are not like, at that time your mind is right there, but you cannot recall what you exactly started with, that is a red flag. So I'm not going to sugarcoat things here. Alzheimer's, it does not have a cure. A lot of research is happening around us, and hopefully in 10, 15 years, things will change. There is progress, there is development, there is treatment, but there is no cure. There are, again, some risk factors that we can work on and be aware. That is our part. So what is Alzheimer's disease? It's basically, there is degeneration of brain cells, and it starts from certain parts of the brain that you can see in hippocampus, and then it affects the whole cerebrum. And what happens is that there are some gunk proteins called amyloid. I'm going to make it very simple. Proteins that are called amyloid, that come in way of all these neurons. There are 70, 80 billion neurons in this 3-pound brain. So these gunk proteins, when they come in between the neurons cannot talk to each other. So the multitasking, following a recipe, doing a task that you were able to do before, that gets interrupted. You have no clue of something that you were doing before, like, regular. Then there are some tangles, they are called neurofibrillary tangles. They also interrupt between the cells. So with this, the cell does not get what it needs, the brain cell, and it atrophies, it becomes smaller. So you can see where the Alzheimer's brain is versus the healthy brain. The white matter, there is a change, there is atrophy, it becomes smaller, it degenerates, and then you see that the space in between the brain is much bigger. All these ventricles here, you don't see much. Oops. It's not connected even. So, okay. So how will we?
Next slide.
Okay, 1 second. I'm sorry, I wish you had mentioned to me earlier. That's okay, this is normal. Okay, let's see. Why is it not happening? I think we need Brother Azad.
Where is the slideshow? Sometimes the arrows
Maybe
will
it's
do
something.
it. The arrows.
This is
Yeah,
our
it's coming,
slideshow.
yeah.
Okay.
So this arrows.
Okay. Thank you so much. Jazakallah khair. Simple. Okay. So we talked about.
You want to turn this a little bit this way?
Yeah, so I can see exactly. I'm sorry about that, but we'll make up for it. So we talked about, why we are here. We talked about dementia as an umbrella term, and then Alzheimer's is the biggest chunk of it. Then we talked about normal aging versus Alzheimer's disease. Then we were talking about this, that, how the brain atrophies in severe Alzheimer's versus healthy brain because of the degeneration. And it is a progressive disease. Now I can't see on my computer, so I have to look there. Okay. So it's a progressive disease, and just for us to remember that our brain is not just for memory. It has a lot of other functions. It has visuospatial orientation, executive functioning, recall, abstract thinking, orientation. So all these things make up the functioning of the brain. It's not just to remember stuff, right? So some of those things, language, orientation, attention, some of those things will start getting affected besides the memory problem. Okay, So we'll quickly touch base on myths about Alzheimer's. It is part of aging. No, it is not. Risk increases with age, but not that everybody with age somehow some time will get Alzheimer's. So that is one thing. And then we talked about that, yes, dementia, the most common cause is Alzheimer's. They are not exactly the same things. There are many other dementias that are there. Alzheimer's is not fatal. Uh, it is fatal. It is progressive and there is no cure. But we will talk about things that will help us to know that there is a positive side to it also. What can we do? Only older people can get Alzheimer's. There are, in America, there are about 6.9, about 7 million people with Alzheimer's disease, out of which 200,000 people have Alzheimer's younger than 50 years of age. That is a very rare genetic thing that happens in families, and families know that, my dad, my grandfather, my uncle, they all had it. I need to be genetically tested. And it's a 50% of the family members have it. So it's very obvious. So we don't need to worry about all that. But what I'm saying is it can happen in people less than 65. Alzheimer's is more common in people more than 65. That's the general rule for 98, 99% of the case. Certain medications can cause Alzheimer's. No, they cannot, but they can augment in cognitive decline. That we have to look at the whole picture of a patient when patient comes to us, that what medications we need to take out or decrease or add. But no medication has the power to cause Alzheimer's. Aluminum can cause Alzheimer's. There was this talk about, the food that we, aluminum pots and all. No, it cannot. Yes, it may interfere or may be a risk factor, but it cannot cause Alzheimer's. The myth is that it is not possible to diagnose Alzheimer's until autopsy. Right now, we can diagnose very clearly, and I'll show you the pictures, just by history, some labs, imaging, and there is something called PET scan, which can highlight all those areas where there is degeneration and very pathognomonic, very significant for Alzheimer's. It is Alzheimer's unless proven otherwise. So yes, we can diagnose this with it without autopsy. It can be prevented by a food or supplement. No, it cannot be prevented by a certain food or supplement, but certain foods and supplements can help to decrease the risk of having Alzheimer's. Getting diagnosis is not important as there is no treatment for Alzheimer's. That is incorrect. Earlier we get the diagnosis, so much can be done to delay the progress of Alzheimer's. Okay. So this slide, I want you to pay attention to. Why? Because in red are the factors that we cannot change. We cannot change our age, we cannot change our family, we cannot change our genes. Okay, so those are the risk factors that are there. That more than 65, yes, there is increased risk. More than 85, the risk is increased by 1/3, much more. Family history, if one family member, like either a parent or a sibling has it, then the risk is more. If two, then the risk is further more. And genetics. Some people get the genetic testing. Only those that have already talked to the genetic counselor and the physician recommends. We don't recommend at all for any and everybody to get genetic testing to know if they will end up having Alzheimer's or not. It's not recommended. It's not useful. It has more harm than good, and it's not going to change anything. May just add to your stress and all that. And it's not, studies have shown that it's not even, we should recommend not to do it. Okay, so there are risk factors, just like, anything that's bad for the heart is bad for the brain. So high cholesterol, hypertension, diabetes, what they are doing is they are messing up with the blood vessels that are providing nourishment to the cells of the brain. So any hypertension, diabetes, high cholesterol is going to affect that down the road, 20, 30, 40, 50 years down the road. Why we are talking about that is that in order to to have a good control over these, to manage these properly. If you have hypertension, you have hypertension. But don't forget to take your medications, keep an eye, keep the monitor at home. As long as it's controlled, alhamdulillah. So, and then sleep apnea. Sleep apnea is this elephant in the room that, I want to spend a minute on that. Sleep apnea is something that, gets undiagnosed so frequently. However, the damage it does is, is very vast. While the apneic episodes that we get, like when we are sleeping, the tongue falls behind, for a second, there is this cut off of oxygen to all the vital organs of our body, brain, heart, kidney, lungs, total no oxygen. Okay. So if you count all these seconds together in one night, multiple seconds that our brain was or our heart was deprived of oxygen. That means it was dead for that second. So, if there is a person who, there is history of snoring, the spouse knows that there is history of snoring, and there is daytime fatigue and all, please talk to your physicians about getting a sleep study done. Right now, the sleep study is very, very easy. You can do home sleep study. You can take it's like a big watch that you take home, you return it next day, and it can, give you the whole story of, and the treatment can save us from heart attacks, from strokes, from whatnot. There's a whole big list of things that it can save us from. So, we get used to that, okay, snoring, so what? We had been snoring for years. The damage is additive, it's all accumulating. So, if there is any concern, please get checked because the treatment can save us from big problems down the road. Traumatic brain injury, head injury, elderly people, make sure there are no loose rugs and there is enough light and there's no clutter on the way from, them going from their room to the bathroom in the middle of the night because, traumatic brain injury has its own problems and then it is a big risk factor for developing dementia down the road. Alhamdulillah, we don't have to worry about the alcohol parts. Anybody smoking, cut down. Everybody knows that there are health hazards. Hearing loss. Hearing loss, interestingly, again, it's one of those things like sleep apnea that needs to be treated. Even if you feel like you can manage or, it's okay. But if the spouse is noticing, a family member is noticing, it's always good to get checked. It is a problem here, that expense is a problem with the hearing aid, but now there are other ways, there are some aids Costco has and, whatever. But please don't let untreated hearing aid be a big risk factor for untreated hearing loss, be a big risk factor for causing dementia. 30%, which is a big percentage, risk increases in patients who have untreated hearing loss leading to dementia. They can manage at times, and then later they cannot manage. They miss important information, and not just that. There is a direct brain and ear connection, and the risk increases every year if we have untreated hearing loss. So that's enough for the hearing loss. But I just want to make sure that if you have a family member and all, please get checked for it. Don't just say that I can manage it. No, your brain is struggling to manage all that. Poor eyesight, again, it is a risk factor. Studies have been done. If somebody has cataract, something that can be treated, make sure if there is glaucoma, you're taking your eye drops regularly, get your cataract treated. So all these are modifiable risk factors. In other words, being cognizant of your health, of what the problems we have, and how compliant we are with the management, and how much are we in touch with our physician. Not that we saw the physician 3 years ago, and yes, I'm on my blood pressure medicine. I don't feel bad, so I didn't take it today. I hear it all the time. Whether you feel bad or good, you have to take your blood pressure medicine. And these are the risk factors that I'm going to come back to talk about, that how beautifully these can improve improve our overall health and save us from all these comorbid conditions that have not come yet, including Alzheimer's. Diet, processed food, saturated fats, sugars, they are, causing problems here. Sugar, if you give a big, a load of sugar to a patient and you do a PET scan, the way the PET scan picture is so similar to a patient who has taken cocaine. Cocaine